dedication, his dedication to the teachers, to the students, I could see when I visited him about 3 weeks back. All the students, they came, and it was his direct interaction with the students that showed his ability as a teacher to communicate with every young student as well as his postgraduate students and the interns. I was there in his chamber when he was interacting, and they were all commenting on the 5th edition, of course, of the book, which every one of his students liked it so much. He is a born leader, loved by his students, colleagues, and friends. He is always seen participating in cultural activities very prominently, both at his college, at the university, and I've seen his participation in other clubs like Lions Club or Rotary Club also. And that is service to the society, sir. I'm a Rotarian. I know how one feels serving the society through your own means as a professional. Besides the academics of surgery, he is well known as a singer of classical Hindi songs from Bollywood and others also. The videos of these are in circulation on YouTube and on WhatsApp. I have been circulating these songs here, the videos of his songs, to all my authors, the club of authors that I'm running on WhatsApp. He is ably supported by his wife, Dr. Anita Shinoy, who is professor and former head of Department of Anesthesiology at KMC. And this book is a result of the bond of the surgeon and the anesthesiologist, who are seen to work together both in the OT as well as the writing and editing of this book. Not only this book, but they have brought together 3 other books: Manipal Manual of Clinical Methods in Surgery, Manipal Manual of Instruments, and Manipal Manual of Surgery with Clinical Methods for Dental Students. Friends, I now present to you Professor Rajgopal Shinoy, an evergreen personality who exudes his academic pluralism. I'm saying pluralism because he represents a genre of surgeons who have a large experience at his back and who does not, who does not want any lacking of sharing that experience with the others. Usually in professionalism, it happens that you don't share the ins and outs of your professional achievement, but he shares with everyone. And he has a sense of great responsibility when he writes, when he presents, and when he teaches. Now I would request Mr. S.K. Jain, our chairman of CBS Publishers, to introduce you to the history and legacy of this great title, which has made a magical mark on the learning and teaching of surgery, not only in India, but in over 20 countries internationally. Over to Mr. S.K. Jain.
Good evening, everyone. I am very happy and elated to present to all of you the 6th edition of our very popular textbook, Manipal Manual of Surgery, written by Dr. K Rajgopal Shinoy and Dr. Anita Shinoy. This book has a unique history of having evolved from a small cyclo-style landscape, which became popular in Karnataka around 1985 or 90. Having learned of his popularity, I contacted Dr. Shenoy to write a book for us, and the first edition of this title, which was based on his notes, came out in 2000. And as the popularity grew, we brought out the reprints every year. We had a good fortune of bringing out the new edition periodically, and the 2nd edition came out in 2002, 3rd edition in 2010, and fourth edition in 2014. The fifth edition, with many major changes, came out in 2020. As the academic development countries, so are the changes in the curriculum. The new CBME syllabus has made it compulsory for us to bring out the sixth edition now, so that entire text need the requirement of the students and the teachers according to the competency based undergraduate curriculum for the Indian medical graduate as prescribed by the National Medical Commission. The book serves a very high percentage of MBBS students, though a few postgraduate students also like to read it as a stepping stone. One of the mega features of this book is that the content and presentation of this book is based on the reviews and comments given by the students, and its popularity has grown so much that it is brought and read by the medical student in more than 20 countries. I am proud to present to you the sixth edition of the manual, which is being released virtually. The discussion that will follow with the author, Dr. K Rajgopal Shinoy, the chief guest, Professor Sidesh Ji, he's not there, I think, and Professor Sanjay Jain, and the eminent panelists from the surgery community will help us in the further promotion of the book at the different institutions and academic circles in India and abroad. Now over to Professor Shenoy for his presentation and involvement with the panelists in the discussion. Thank you very much.
Thank you, sir.
Firstly, let me thank CBS Publishers and Distributors New Delhi for arranging this program and for constant support, encouragement given to us for last 20 years. I'll call from Millennium Edition to now CBME Edition. Before I proceed, there are two people, sir. There is one named as Dr. K Rajgopal Shinoy, with the person standing, that is please name as Dr. Balaji Singh. Dr. Balaji Singh. I have sent a message to in the chat box, and another person named as B, the photo you can see Dr. Pratap Parute. I also message that in the chat box. Please do it. Anyway, what can I say for this is that necessity, arose. It is not because I wanted to do it or something. Suddenly, the changes in the curriculum brought about by NMC, National Medical Commission, about this competencies, they wanted us to include the competencies. The reason for which we have brought out this book. Now, I'll be talking about it little later about the more details. But before we proceed now I would like to first introduce few of my very important colleagues. I can call them as also faculty from established institutions and also my colleagues from the Association of Surgeons of India. Firstly, Professor Sidesh, he is here now. Thank you, Professor Sidesh, for taking time to be here as a part for this release program. Is a former professor, HOD, medical school of JSS Medical College, Mysore, now running his own hospital. Professor Sanjay Jain, my another colleague, he is the Vice President of Associate Surgeons of India, also professor from Gandhi Medical College, Bhopal. A good friend of mine, worked as a secretary, and we were involved in a lot of interactions during COVID time, over this for the teaching programs. Sir, thank you for coming here. Professor Ajay Khanna, very senior person, my well-wisher, and we are for the last 2 years, COVID time, we became actually friends through this lot of online platforms which we had, whether it's Association of Surgeons of India or Learning General Surgery platform from Chennai based, or National PG clinics from Kanakvel. Kanakvel is also joined. I have seen him in this list now. National PG clinic is organized by him. Sir is from Varanasi. And sir, thank you, sir, very much for joining for this platform. And Dr. Balaji Singh, I think I mentioned, yeah, Pratap Varute has been named now. He is our Secretary of Association of Surgeons of India from Kolhapur. And Dr. Balaji Singh, you will see him. He is a professor, HOD, Dean Faculty of Sri Ramchandra Medical College, Chennai. So apart from this, there are few others also I have invited. They might have joined. I welcome Academic Director of the ASI, Professor Santosh John Abraham, if you are joined here, sir, as attendees there. And any other, whom I have invited very limited number of people for this here for the release function. So with this, I think I invite all, I welcome all of you for this program. And let us continue with the today's release program. Over to Madam Anu Reina. You are muted, Madam.
I'll end. Thanks a lot, sir, for your wonderful inputs. And I would also like to thank Mata sir and Mr. Arjuna for giving letting us know the journey of your book, the blockbuster book. Thank you once again. Sir, I now would like to welcome here Dr. Siddesh to say a few words. Dr. Siddesh ji, Professor Siddesh. Professor Siddesh.
Baglaki. Yeah.
Yes,
Thank
Professor
you.
Siddesh.
Yeah. Thank you, Anu. Good evening,
Welcome, sir.
everybody. It is indeed my proud privilege to be amidst this elite crowd, which you have made it possible to get together, all of them, for this a wonderful occasion of release of this, as you have been mentioning, blockbuster, iconic. You can say many more words. Everything will fall short because it is popularity and its usage across the globe have proven all these words are not enough just to describe this mammoth effort put in by both Dr. Rajgopal Shinoy and his wife, who has given an equally good shoulder to him in bringing out this every time, that is Dr. Anita Shenoy. I know them personally too well, and I also see on the dais, virtual dais, my colleagues who are very close to me, Dr. Professor Khanna from Varanasi, my Vice President of Association Surgeons of India, Dr. Sanjay Jain, Dr. Balaji Singh, who is the HOD of Ramchandra Medical College at Chennai, and our Honorary Secretary, Pratap Varute, he is here. Thank you. And I also see again Dr. Prabol Neogi, who is a professor of surgery at Allahabad, Prayagraj Medical College, Government College, and many more of you who have joined virtual meeting. And I greet you all well. And at the same time, I again express my happiness that I have been the chief guest to release this book. I don't know what I can say to my one of the dearest person whom I had in my life. I can just say, people have described love at first sight. You know, this is one guy whom you have friendship at first sight. He can be like that to many people who come across his life. Very few have that charm and affinity who can stick on to these kind of people, and Rajgopal is one such kind who cannot be hated by anyone, but they can only love him with whatever qualities he has. And these qualities have been amply well illustrated by our friend here, Dr. Arjun. But I will tell you that is only a small few words what he has told. I would like to say some of these virtues, what I have professed to admire for the last over 3 decades. I will tell you, this man is a clinician par excellence. He can just bring out to be very simply using the basic clinical science, how one can achieve great diagnosis. You can learn from him. And that is the really any student who has worked with him for some time will watch for that. They have learned this art from him. And at the same time, he has been invited as a faculty all over the country as a teacher par excellence at the same time. It is very rare to find a combination of an excellent teacher, a good clinician, at the same time, a good surgeon. So these three rarely go together. And we have one individual who has got all of that. And add to that, I was just mentioning before the beginning of this function, to write, if you ask me to write 1 page, 1 article, I would take not less than a week to coin, do editing, and see, this is an art by itself. And everyone of us don't have this. And this is one individual who has inculcated from his very early days in his college, or maybe even earlier. So that is a God-gifted thing. We are all really happy to have him amidst us with that rare capacity, in addition to all those rare qualities which I have mentioned. And all of you also know about his other qualities other than the profession. He is always smiling, though, and his voice is loved by everyone on the dais. Whenever there is an occasion, we invite him. He is more than welcome to come in, and that shows his simplicity. That is another aspect which you can appreciate about Rajgopal. Today, Rajgopal, you will have to allow me to tell all this. I'm not lying any bit of it. This is coming from my heart, and I am not even prepared or written anything. It is just coming out of my heart and extempo. You can believe me that. And then you see, he kept on entertaining day after day in the pandemic throughout more than a century of songs. He had no hesitation. He never got bored, and every new song he sang with the same real enthusiasm as he began with it. So I think that is what is Rajgopal. He felt the need for keeping the flock together in this hour of crisis. So that is Rajgopal for you today. And then he is a perfectionist. Being a perfectionist, you cannot be very simple and kind-hearted. I have come across many perfectionists. They are very tough individuals. People would like to stay away from them than to be very close. And this perfectionist, you will love to be very close to him. So that is what is Rajgopal Shinoy in a nutshell, in few words and few minutes. I can tell. I can go on talking about him. I think this august audience would appreciate my true words, what I have spoken in its true sense. And writing a book, 6th edition, it just speaks volumes. It is not just it is a humongous effort on his personal capacity. And also, I would equally compliment Madam Shenoy for giving his able support for bringing out this. And what he has changed, I have observed very closely over the years, these changes which have occurred in this book, his pattern of the formatting, the pictorial diagrams, the amount of effort he has gone in to collect the photographs. Wherever he goes, he tends to take photographs and edits them and puts it in appropriate place. And that is very nice of him. He has a very vast collection of these material as well. And lastly, I would say the change which is very apparent and which is very essential for the modern day world, because reading a book has also become a rare phenomena among students, which you all see. I used to spend most of my day in the library sitting as a postgraduate student. Today, we hardly see libraries are filled, because if there were no chairs to search, we used to reserve a book first in the morning in the library so that we can read it throughout the day there. So that is rare phenomena now. I'm sure all our professors here would agree with me. And if at all anything has to change to make them to come back to books, is to change the format, make it more attractive and presentable. And that's what I have seen in the recent edition, where there are highlights, where you can go, there are in different colors. It is summary of the chapter. Beginning also, we have the highlights, what is going to be there as a content. So each chapter has been put up in such a nice formatting That is also equally important. So I think he has taken into those minute details as well. I would highly recommend this book for usage not only by undergraduates, but also the postgraduate students, and also for consultants like me. As a ready reckoner, I would love to have it on my table anytime. It would be of great help for me. Thank you very much, Rajgopal. Your effort is wonderful. I only pray God you continue doing this job, wonderful job, for the good of all the medical faculty fraternity in general, and also humanity. So he is also one of the greatest human beings I have come across in my life. I would like to end by saying that. Again, I take this opportunity to congratulate the CBS publishers from New Delhi and their whole team, including Varun Jain, having taken this opportunity, given me an opportunity also to share this platform and share some of my views. Thank you very much and wish you all the well. And congratulations again for the release of this book. Thank you.
Thank you so much, sir.
Thank you,
Thank
sir.
you, Siddesh. Thank you.
Thanks a lot, Professor G. Siddesh, for your valuable inputs. I could see that you have added lots of adjectives for our Dr. Shinoy. So he really is, he doesn't require it, but he really deserves it. Now, I would like to take an opportunity to call upon our guest speaker, guest of honor, Professor Sanjay Jain, Professor and Head Surgery, Mahatma Gandhi Medical College, Bhopal. Professor Sanjay Jain, please.
Thank you, madam.
Thank
Good
you,
evening, everybody. Good evening, everybody. Today, we are having the esteemed panel of members from the surgeon side and from the publisher side. So at the very outset, I would like to say thank you for inviting me for this wonderful event. And I really feel privileged to be the part of this virtual release ceremony of the 6th edition of the Manipal Manual of Surgery by Dr. Rajgopal Shinoy and Dr. Anita Shenoy. See, what I would like to share, that though there's no wonder that this is one of the most favorite book of the students, whether they are the undergraduates and even the postgraduates, in their good reasons for it. I have come to know that the book is being circulated in the 20 countries. What I can say about the India and the Asian countries, when we have a book from Indian author, it is easier for us, because what I can say, there are 3 R's involved in learning. One is reading. So there is ease of reading in this book. Second is revising, because if you do not revise, you are bound to forget things. So there is ease of revising. And third R is remembering. Once you read and you revise, definitely you are going to remember. And last R is the reproduce in the examination. So that these books give a unique opportunity. Once I was taking a class, I asked some of my undergraduate students at which book they are referring. So they proudly said, this is the book. And then I showed them a picture when I was involved in the release of the 5th edition of this book at one of the SECon, and they were more than happy. And now when I will be sharing that the 6th edition also, I am there. So this I feel proud of it. We all know that the science is changing at a fast pace. There was a time when we were students, when our professor wanted that we should read a book by Professor Ayanard, which was there, a copy in the library which was 20 years old, and we used to go and read it. Today, a book which is a decade old is probably not, it will not be proper to go or consult that book. It's one aspect to write a book, and the more important is keep it revising, keep the pace with the development of the science. We all know the treatment guidelines change every 2 or 3 years. The staging of cancers, they change every 3-4 years. So we have to be practical and we have to keep updating. So I would like to congratulate Professor Rajgopal Shinoy to take that responsibility in a short period. Whenever it was required, he was there with the new edition, and this time we are here with the 6th edition of this book. Definitely, this is a very big event for and very good opportunity for all of us to have this prestigious book. See, the writer and the publishers have done their job. It is our turn as the teachers or the students to update our library with the recent edition. So just before I conclude, I would like to say thanks, Professor Siddesh, who happens to be the president of the Association of Surgeons of India. We have Professor Khanna, who is teacher of teachers, Professor Balaji Singh. I see Professor Prabal Neogi, Dr. Pratap Varute, who is a very energetic surgeon, organizer, and active secretary of the Association of Surgeons of India. From the publisher's side, I would like to thank Mr. S.K. Jain and Mr. Varun Jain, who are the chairman. I say thanks to Mr. Anur Raina, and I also saw a few others. So this is a wonderful evening, a good time to celebrate the release of this prestigious book. And I would like to congratulate the writers, the publishers, and I would like to convey my best wishes to the author, Professor Rajgopal Shinoy, and also the readers who will be getting the current what is there in surgery. Along with this, the more about the book, it will be good to hear from Rajgopal sir's mic rather than me speaking about it. Thank you very much. Thanks for inviting me, and have a nice evening. Thank you.
Thank you, Professor Sanjay Jain. Our next guest of honor is Professor K. Balaji, Ramachandran Medical College, Research Institute. I would like Dr. Balaji to say something about the event and the book.
Respected Professor Siddesh, Professor Sanjay Jain, and hero of today, Professor Rajgopal Shinoy, my teacher, my mentor. Actually, I still remember in 2000 when his first book was released in ASI Madurai. There was so much of applause. And through the foreword of the book, many were stunned to see such a lovely book. I was his postgraduate student in Manipal, and he was an excellent teacher. Evenings, I used to wonder when I go for rounds to see the patients, there was a huge crowd of undergraduates in front of a room. We'll be seeing Professor Shenoy, who is being committed in teaching. No, his notes are so famous and familiar, and those things motivated him to come out with the book. And he's a lovely teacher and mentor. And to be surprising, to quote one thing, recently I called him as an examiner for MS. He was here, and there was an on-site NMC visit. When they came inside, they said Professor Shinoy, and I introduced him. He's Professor Rajgopal Shinoy. You know what the person said? So I read your book before I go for a class. So imagine a teacher themselves committing that. They read his book and refresh before going for a class. So it is such a simplified way he has brought out things. And I know this 6th edition, it's a competency-based medical education thing, CBME. I can assure you that this is the first book of this sort in general surgery, which is going to come out. And I'm very, very sure most of the students get benefited by it. As already Siddesh and others mentioned, anyone you ask him, like, what book you are reading? Sir, Rajgopal Shinoy, sir, book is good. Manipal Manual is very good. You're able to recollect things. Everything comes in my mind. I don't know what to write, what to leave. Such a sort of remembrance you have once you read his book. He gives lovely mnemonics, which will be like, you cannot forget. And pictures are so clear and clarity. Above all, a student, when he goes for an exam, he should have, no other book gives about instruments, specimens, operative surgery, and other things, right? So X-rays, everything is lovely depicted in his book. So most of them are benefited by reading the book. I'm very sure most of the medalists, say I've been in teaching profession for past 30 years. I can see from 2000 on, his book is a popular book in our college, not only our college, wherever I go, across 20 countries, they have been mentioning, right? His book was so nice, comprehensive. Professor Anita Shenoy has given a chapter on anesthesia, which is so easy for undergrad, even for postgraduates. I'm telling you, even postgraduates benefit by that. So it's really a good, lovely book for a surgeon, for an undergraduate, for a postgraduate. Professor Shenoy, hats off to you. You are definitely a lovely teacher, good mentor for many teachers. The dedication, the commitment you have in teaching is phenomenal. Sir, I really appreciate the efforts you have put in. Though we are all also teaching, but the effort you put in, we don't even have 10% of what you have done. So it's hats off to you, sir. And I should appreciate CBS for literally nagging him rather to bring out new volumes and new editions. So I definitely recommend this book, and many will benefit and gain knowledge by reading that book. So thank you for giving me this opportunity. Hats off to Professor Shenoy. Thank you.
You are muted, madam. You are muted, madam. Yes.
Thanks a lot, Professor Balaji. Thanks a lot for your great inputs for the book, and your recommendations is going to help us to adopt the titles at the higher level. Now, I would request next guest of honor, Professor Ajay Khanna, former Head Department of Surgery, Institute of Medical Sciences, Banaras Hindu University. Kindly say a few words. Professor Ajay Khanna.
Thank you, Anu, for your kind words. I think this is a very important day in a surgeon's life and an academic life. You know, being the author of about 5 or 6 books, which have been released by the Springer, whenever my book comes for that, on that day, I really feel cherished. And this is the day for Dr. Shinoy, that he must cherish this day that his book is being released. You know, we have been always talking about the Bailey Love and the Schwartz and the Sebastian and all those books which are there. But now this era which is there is of India. And our Prime Minister Modi ji has said that everything should be made in India. And Dr. Shenoy is the one person who is going to take our surgical education in that context. So I really congratulate Dr. Shenoy that he has done a real wonders for this book, you know. Though I have not seen his 6th edition, but I have very thoroughly gone through the 5th edition of his book. And in the 5th edition, even, you know, you got so many good things which are there, which you will not get in other English books which are there. The types of the tables he has provided, the types of the figures he has provided, the type of the boards he has provided, the type of the various small things to remember he has provided, the MCQs he has provided. So almost it is a comprehensive of almost everything. And I'm sure that this 6th edition will be even much better than the last edition. And because he has comprehended because of the competency-based program which is there, which is now the day of for the education. So he must have taken care of all those things which are there in this 6th edition. You know, as far as Dr. Shenoy is concerned, though I knew him for so many years, but personally, we became more friends in the last 2 years during the COVID time. When Dr. K Rajgopal started the PG clinics, and during that, myself and Dr. Shenoy and many others who were, Dr. Jayalal was there, and Dr. Antharia was there, Dr. Shai was there. So all those were in very close collaboration with each other. And the way Dr. Shenoy used to ask the questions, very basic questions. He would ask very, very basic questions, which really enters the mind of the student. So he is a very capable, I say, there is one word, what is called attitude. This is one word. If you take it from A to Z, and you start calculating, like attitude A is 1 mark for that, and T is around, I think, probably 20 marks for that. So that makes it 100%. The other words which may be there, that you are working very hard, you are intelligent, other things which are there, that doesn't make it 100%. But attitude is the word which you makes 100%. And his attitude, Dr. Shinoy's attitude, which is there, it is for the academics. He has devoted all his life for teaching the students and for carrying out the good work for the academics, which is there. So he's 100%. And then there are few words, in the literature, if you see in the Googles and all those, you will find attitude is a word which is 100%. But then I started finding that what are the other 100% words which are there for any person who is there. One is the mind setup. So in the mind setup, if you is there silent there. And if you calculate again, all those words which are there from A to Z, that is also 100%. So Dr. Shinoy has got that capacity of the mind setup, that he has, even in just in 2 years time, it is so difficult to get a new edition of the book in 2 years time. His last came 22 years back only in 2020, and now it is in 22. Is almost a new type of the book which is there. Then the third word which I found, which is 100%, is the motivate. Motivate, again, E is the silent. If you keep the motivate word which is there, that is also 100%. And again, Dr. Shinoy is a perfect example of that, of the motivation. He motivates his colleagues, he motivates his students, he motivates everyone. So he is a perfect example of that. And finally, he pays all the gratitude. Gratitude, again, the E is silent, and that is also 100%. Whatever he does, he really pays the gratitude to his seniors, to his colleagues, to his juniors, to the patients, to the students, everyone. And so I will say Dr. Shenoy is a perfect example of a academician, and he has been really working very hard with his wife, Dr. Anita Shenoy, to bring out this new book. And I will really appreciate that this book will go all over not only the 20 countries, but it will go all over around the globe. It will go, and people will definitely like this book. And it should not only for the undergraduates. This is a book which is even for the faculty members, I will say, because if you have to remember that what are the 10 causes of this swelling is there, it is in Dr. Shenoy book, which is there, that you can remember there are 10 causes for this. So it will be remembered by the faculty members, definitely for the undergraduate and postgraduates. It is a boon, especially before the exam. When they are going for the exam, they must go through this book and they must see that what are those, and definitely it will be really helpful to the examination. So with these few words, I really congratulate Dr. Shenoy. I congratulate the CSB team which has brought out this new edition of the book. And I know that, I really like the paper of this book. The paper which this CSB is providing it's really good. You can really handle this paper. In the foreword, I've written that one of the very important thing which is there is the quality of the paper which has been used for this type of the book. So again, once again, thank you, Dr. Shenoy, and again, my most congratulations. And I think probably when we have the live ESICON, it will be again released there. Thank you very much.
Thank you.
Thank you so much, sir. Thank you.
Hello.
Thank you, Professor Khanna. We are now moving towards a very important session of book release of new edition of Manipal Manual of Surgery, 6th edition by Dr. K Rajgopal Shinoy and Dr. Anita Nileshwar. Dr. Shinoy, now this dice is yours, and please do the honors.
So thank you very much. I would just like to firstly thank CBS Publishers to bring out. This is the book which is now comes in 6th edition, and this is in 2 volumes, volume 1 and volume 2. Even though book has come out in 2 volumes, but it's very important to realize that the number of pages have not been increased in these 2 books. The ease of carrying the book and probably the quality of the paper. These are the 2 things which have made this into 2 volumes. I would like to tell the students and other faculty members and my colleagues here that one of the changes, whatever we have done, not only competency-based medical education is the one which NMC has specified. We have given the numbers to that, like they have SU 1.1, SU 1.2, 1.3, like that. So that for the students, it is not just the indexing part of it. It is just to go through that, and so that they can quickly go into the page and select the reading. That is the first thing. Second, very importantly, to incorporate all these competencies, obviously, I need to delete few things and to add what's called a basic principles of surgery, which are very important things which have not been usually taught. Ethics, for example. Students will go through 4.5 years without knowing what is ethics, what is research, what is communication skills, what are some very, very fundamental biomedical waste disposal. All these things which have also now been recommended. So these have been incorporated. Interestingly, very much experts who have written few of the contributing things to the book. More than about 15 to 20 of my colleagues, all subject experts have contributed, starting from the research to and at the same time, we have maintained that simplicity of the book. As has been pointed out by Professor Ajay Khanna sir, that yes, Indian authors, Indian people also should be given importance. I have incorporated one of the topics in the book called as Professor Desada repair. I think all of us know that the students hernia repair, which is not given very well in any of the Western textbooks, apart from he himself has written the book. In my book, he has, with my personal request, he himself has contributed his original work, and it has been incorporated in my book, because I thought this is read by the students so that that repair should become whatever more popular. Indian author. Similarly, another junior person, everyone knows about Wagner's grading for diabetic foot, etc. But again, Amit Jain, another youngster from Bangalore, he has also contributed significantly for the diabetic foot, and I have incorporated his classification, his original work in the book. These are all in addition to whatever basic principles, whatever we have brought in the book. Just to make it simple, at the end of the day, we have not at all made it complicated. Language is simple, easy for reading, all those algorithms, tables, etc. And I personally feel that every student will be benefited out of this book. With these few words, I can only say that enjoy reading the Manipal Manual of Surgery book, 6th edition. We have taken all the care to see that lesser mistakes are done, and unnecessary things have been deleted. Or what I call unnecessary because times have changed from whatever years. So we need to delete something, we need to add something, not to increase the bulk, ease of carrying. So that's all I can say about the book. And thank you again, CBS Publishers New Delhi, for bringing out this edition. And thanks my all colleagues, seniors, well-wishers who have spoken all about me. And thank you again.
Thank you, Dr. Shenoy. Now, since we are about to close, we are coming to the concluding part of the event. So before presenting a vote of thanks, I would like Ms. Pratigya to kindly let us know if we have got any questions, because we are now in a question answer session.
Yes, ma'am.
Yeah, kindly ask.
there is a lot of appreciation for the previous books and a lot of good wishes for the new. And the question, I'm just letting it you know. So one question is asked by Azam. Are there any major changes in the new edition? Many of our batchmates have bought older ones as it was available in the market. And when the new book will be available in the market?
Yeah, two things which I have already given you, that about 20 chapters have been added in the initial first chapter, first section called as Basic Principles of Surgery, which I already mentioned, like ethics, communication, biomedical waste management, chronic pain relief, very operative care, interpretation of investigations. So these are the few aspects have been added. And of course, book availability, as I understand, should be available by this month end. I think our publishers will be able to tell it.
Okay.
Next question, please.
Ma'am, as of now, there are not any other questions.
There is one question I can see, that how is the new edition going to help us in the next NEET PG? Are clinical MCQs included?
Yes, it's
Yeah, again, the importance here is that National Medical Commission, again NMC, as competencies are about the text material, which you can ask in the form of MCQs or written, but also the clinical methods. So the incorporation of the clinical methods and clinical case capsules, these are extremely useful for the, NEET examination preparation, because this has been one of the important feature of the book since the earlier editions also. Clinical, I have given as it's been more pointed out, clinical case capsules, pearls of wisdom. These are all very important points for the, preparation for the NEET exam. But let me also tell you, at the end of the day, there's no end for learning. Learning is so many books are available. Issue is that within your time limited constraint, you should be able to utilize the maximum from the book. And I always say in my class everywhere, look at the picture carefully. There are so many things you can learn from one look at the picture, especially surgery, whether it's a goiter or the breast cases or swellings, anything. So spend some time, that itself will help them.
So one more question is there. Could you please let us know what online or app-based features are available?
That I think Varun or from your side, I think.
As far as my feedback is concerned, that we are having the text material and some online features for the students and faculty both. So once the books reach to the students or the faculties, they can scratch the code and they can access the online text and whatever is available on there. That is available on CBIC Central app, so you can have the access through the codes. So there's a question to my contentness. I would like to know, does the book cover things beyond competencies like EdCom material, extra edge points, NEET PG material? This is a question from Vicky Thakur.
Yeah, it's as I already told you, that it just does not only contain competencies. No, it contains more than that. It is going to help for actually basically written for undergraduate, but definitely has been pointed out, it will help for their entrance examination. It will help the postgraduates, it will help the faculty and even teachers also to preparation of for their whatever material.
So thank you, sir. Like I would also like to tell participants that they can put their questions across. We will get back to you those questions because we want to wind up the session. We can get back to you with the answers from the author itself. So you can let us know the questions. You can like email us the questions, or you can put on the chat box right now, which will be taken care for future. And now I would like to present the vote of let us wind up the session. And I would first of all thank all of you who are present here again for their valuable time they have spared and all the speakers, guest speakers, chief guests, and everybody are here. So the vote of thanks, I, Anu Raina, from the bottom of my heart, would like to thank all of you, all the valuable participants and esteemed guests, that they have honored us with their presence and made this session possible. Special thanks to Dr. Shenoy, Professor G. Siddesh, Professor Sanjay Jain, Professor K. Balaji, Professor Ajay Khanna, and I'm sorry if I have missed somebody. Thanks to our CMD, thanks to Mata sir, Mr. Varun, Mr. Arjuna sir, Mr. Bhupesh sir. I would also like to thank my companion, Ms. Pratigya, for supporting me, entire sales and marketing division of CBS Publishers and Distributors, entire back-end marketing division, especially Ms. Neetu for her support in every possible manner. Special thanks to our student ambassadors who have helped us in promoting this event. So in the end, I would like to reiterate that stay tuned with CBS Publishers and Distributors through their online channels for the future online events, webinars, and contests. Kindly do share, comment, and share our post and be the part of this change. Thank you once again. This is Anu Raina signing off. Namaste.
Thank you.
Thank you so much, everyone. Thank you. Take care, please.
Thank you, sir.
Thank you.
Everyone, sir. Thank you,
Thank you.
Siddesh.
Thank you, sir.
Thank you,
Thank
sir.
you, everybody.
Congratulations,
Thank you. Good
Dr.
night.
Shinoy,
It was
on
a
the
wonderful
release.
Thank you,
session.
sir. Good night. Good night.
Thank you,
Thank you,
Nice,
sir.
Balaji.
Right.
Thanks,
Namaste.
Anu.
Thank you,
Thank you
sir.
for
Thank you.
arranging this session.
Yeah, so nice. to
Thank
be
you, sir. Thank
with
you
all
very
of you.
Right.
Right.
Chalo. Great. Thank
Right.
you.
Rajgopal, bye bye.
Thank you,
All the
sir.
best.
Thank
All the best.